HIV, short for human immunodeficiency virus, HIV is a debilitating disease that weakens the immune system to the point where it's difficult for the body to fight off even minor infections and diseases. It specifically targets white blood cells crucial for immune defense, and as the virus progresses, the body becomes increasingly vulnerable to infections that a healthy immune system would typically control. Early-stage HIV patients experience flu-like symptoms within 2 to 4 weeks of exposure, and if left untreated, the disease evolves into AIDS, short for acquired immunodeficiency syndrome, the most severe form of the disease. One reason that HIV is so difficult to treat is that the virus is capable of creating hidden reservoirs that allow it to hide within the body and integrate its genetic material into the host's DNA, letting it avoid detection and eradication. HIV's high mutation rate enables it to rapidly evolve and develop resistance to the body's immune response and medications, making it difficult to develop universal treatments. There have been significant advancements in treatment, including antiretroviral therapy, which suppresses the virus to undetectable levels in the blood and prevents the progression of HIV to AIDS. However, the dormant virus can reactivate if treatment is stopped. Alzheimer's disease. Named after Alois Alzheimer, a German psychiatrist and neuroanatomist, Alzheimer's disease is a devastating neurodegenerative disorder that presents itself in older adults. It begins with mild memory lapses, but unfortunately, it inexorably advances into severe cognitive impairment and erosion of personality. The root cause of Alzheimer's is the accumulation of abnormal proteins in the brain that form plaques and tangles which disrupt communication between brain cells and eventually lead to cell death. This widespread neuronal damage results in the shrinking of brain tissues, particularly in the hippocampus, responsible for processing memory, and the frontal lobe, responsible for reasoning. Despite decades of research and numerous clinical trials, there is currently no cure. The disease often progresses silently for years before symptoms appear, meaning that by the time it is diagnosed, significant and irreversible brain damage has already occurred. Another factor preventing the development of a cure is that the brain's protective blood-brain barrier limits the effectiveness of many potential drugs. Treatments that can help manage symptoms and improve quality of life do exist, such as medicine to improve memory loss and inhibitors that prevent the breakdown of neurotransmitters necessary for cognitive function, but they do not stop the disease's progression. Cystic fibrosis. Cystic fibrosis is a deadly disease that causes the body to produce thick and sticky mucus that obstructs airways in the lungs and clogs ducts in the pancreas. Patients with CF often suffer from recurrent lung infection and persistent coughing, and over time, the continuous cycle of infections and inflammation causes respiratory failure, the primary cause of death in CF patients. The disease is caused by mutations in the CFTR gene, which encodes a protein responsible for regulating the flow of salt and fluids in and out of cells. There are over 2,000 different mutations identified in the CFTR gene, and the diversity of these mutations complicates the development of a universal, one-size-fits-all cure. CFTR modulators that target specific genetic mutations have been developed, but these therapies are not effective for all CF patients and do not fully reverse the disease's effects. Furthermore, the progressive damage caused by CF begins early in life, often before a diagnosis is confirmed, making it difficult to prevent long-term complications. Gene therapy that aims to replace the defective CFTR gene shows promise. However, delivering genes effectively to lung cells remains challenging due to mucus barriers and immune responses. Amyotrophic lateral sclerosis. In 2014, the Ice Bucket Challenge went viral on social media, in which people would brave a bucket of ice water being poured over their head to raise awareness for ALS, also known as Lou Gehrig's disease. It is a progressive neurodegenerative disorder that attacks and destroys nerve cells in the brain and spinal cord called motor neurons, which are responsible for controlling voluntary muscles. As these motor neurons degenerate and die, they stop sending signals to the muscles, leading to muscle weakness, atrophy, and eventually paralysis. Cognitive functions are typically spared, leaving patients fully aware of their decline. The causes of ALS are not entirely understood, so a cure remains elusive. Approximately 5 to 10% of cases are familial, while the vast majority are sporadic with no clear genetic link. The speed of progression varies immensely, with some losing function quickly, while others continue walking and talking for years. The few FDA-approved medications only modestly slow the progression of the disease and do not offer a cure. Parkinson's disease. Parkinson's disease is a highly progressive neurodegenerative disorder that primarily affects movement, but its impact extends far beyond motor symptoms. Early signs of the disease often include tremors and difficulty with balance and coordination, with later symptoms consisting of speech difficulties and cognitive dysfunction. Over time, these symptoms worsen, and individuals with Parkinson's begin to require assistance with daily activities as both physical and mental functions deteriorate. The root cause of Parkinson's disease lies in the gradual loss of dopamine-producing neurons in a specific area of the brain called the substantia nigra. Dopamine is a critical neurotransmitter that helps regulate smooth, coordinated muscle movements. When these neurons die or become impaired, dopamine levels drop, leading to the tremors Parkinson's is known for. Abnormal protein clumps known as Lewy bodies also accumulate in the brain that cause neurons to malfunction and die. Unfortunately, by the time Parkinson's disease is diagnosed, significant and irreversible neuronal loss has already occurred, and despite decades of research, the only treatments that exist are ones that temporarily replenish dopamine levels, but don't halt the underlying neurodegeneration. Huntington's disease. Huntington's disease is a hereditary neurodegenerative disorder caused by a genetic mutation in the HTT gene, which leads to the production of an abnormal version of the Huntington protein. This malformed protein accumulates in the basal ganglia part of the brain, responsible for controlling movement, ultimately damaging and killing neurons. Individuals with Huntington's disease often experience uncontrolled, jerky movements, impaired cognitive function, and emotional disturbances such as depression and anxiety. The mutation responsible for the disease involves a repetition of a specific DNA sequence in the HTT gene. The more repeats present, the earlier and more severe the onset tends to be. Children of parents affected by Huntington's disease have a 50% chance of inheriting the disease, so intercepting it before it can progress is extremely difficult. Certain medications can help control involuntary movements and manage mood issues, though these do not address the underlying cause. Gene silencing therapies show promise in reducing mutant Huntington protein levels, but even if the faulty gene could be silenced, severe brain damage can't be reversed. Sickle cell disease. SCD is a hereditary blood disorder that affects hemoglobin, the protein in red blood cells responsible for carrying oxygen throughout the body. The disease gets its name from a mutation in the HBB gene that causes red blood cells to become rigid, sticky, and crescent or sickle shaped, rather than the typical flexible round shape. These abnormally shaped cells can clump together, leading to blockages in small blood vessels, which restricts oxygen flow to various parts of the body. This results in episodes of severe pain, known as sickle cell crises, and can lead to damage to vital organs. SCD typically reduces life expectancy by at least 20 years, with many patients facing ongoing health challenges throughout their lives. Historically, the only potential cure has been a bone marrow or stem cell transplant, which replaces the patient's defective blood-forming cells with healthy ones from a compatible donor. However, this procedure is highly costly and requires a perfectly matched donor, which is not available for most patients. In 2023, the FDA approved Casgevy, a type of gene editing therapy that uses CRISPR technology to edit the patient's own blood-forming stem cells. With more time, this could become a functional cure. Lupus. The most distinctive sign of lupus is a facial rash that resembles the wings of a butterfly unfolding across both cheeks. It is classified as an autoimmune disorder where the human body's immune system mistakes healthy tissues and organs for foreign invaders and is capable of affecting multiple organs and systems in the body, including the skin, joints, kidneys, heart, lungs, brain, and blood cells. Certain genes may increase susceptibility to lupus, but not everyone with these genes will develop it, suggesting that external triggers like UV exposure or stress may play a role. Anti-inflammatory drugs and immunosuppressants can help manage symptoms and prevent organ damage, and steroids are frequently prescribed to quickly reduce inflammation during flare-ups, but they don't address the underlying cause, and long-term use of steroids can lead to unwanted side effects such as weight gain. Biological therapies like the medicine belimumab are specifically designed to treat symptoms of lupus, but the disease's multifaceted nature complicates the development of a proper cure. Multiple sclerosis. Multiple sclerosis is a chronic, often disabling autoimmune disorder that affects the central nervous system, which includes the brain and spinal cord. It occurs when the immune system mistakenly attacks myelin, the protective sheath surrounding nerve fibers, leading to inflammation and subsequent damage. MS is more prevalent in women than men, and typically develops between the ages of 20 and 40. Patients may experience vision problems, coordination and balance issues, and in severe cases, partial or complete paralysis. Vitamin D deficiency, smoking, and prior viral infections such as Epstein-Barr virus are believed to give rise to MS. It manifests differently in each person, with some experiencing periods of flare-ups followed by recovery, while others have steady neurological decline without remission. Disease-modifying treatments can slow the progression of the disease and reduce the frequency of relapses, but once myelin or the nerve fibers themselves are destroyed, the body has a limited capacity to repair them. Type 1 diabetes. Type 1 diabetes is characterized by the body's immune system mistakenly attacking and destroying the insulin-producing cells in the pancreas. Insulin is a crucial hormone that regulates blood sugar levels by allowing glucose to enter the body's cells for energy. Without insulin, the body develops hyperglycemia, where glucose builds up in the bloodstream and starves cells of their energy. Unlike type 2 diabetes, which is often associated with lifestyle factors like diet and exercise, type 1 diabetes is an autoimmune disorder with no clear preventable cause. Current treatments focus on lifelong insulin therapy, where patients must monitor their blood sugar levels meticulously and administer insulin via injections. Unfortunately, it remains incurable, largely due to the complexity of the immune system's attack on beta cells, which when destroyed do not regenerate naturally. Scientists are exploring approaches like stem cell therapy to regenerate insulin-producing cells. However, ensuring the body doesn't attack the newly introduced cells as well complicates the completion of a catch-all cure. Crohn's disease. disease. Crohn's disease is a chronic inflammatory condition that primarily affects the gastrointestinal tract. It can affect any part of the digestive tract, though it most commonly targets the small intestine and the beginning of the large intestine. Those with Crohn's often experience severe symptoms, including persistent abdominal pain and bloody diarrhea, and have an increased risk of colon cancer. While Crohn's disease is not typically fatal, patients often have to adhere to strict dietary restrictions and take long-term medications to control inflammation and prevent flare-ups. Flare-ups can occur unpredictably, even when the disease seems to be in remission, and often require hospitalization or surgical interventions to remove damaged portions of the intestine. Crohn's disease is also hereditary, meaning individuals with a family history of the disease are at higher risk. Developing a cure is complicated by the unpredictable nature of the disease, as it manifests differently in each patient, affecting different parts of the gastrointestinal tract with varying severity.